and welcome in to Your Health. And we were talking earlier, you know, March is the month of colorectal cancer awareness. And we are so fortunate, folks, because we couldn't have anybody better. We have the Dean of the Montgomery Regional Campus UAB Medical School, which is right here in Montgomery. And we have Dean Lou Lambiase. And you are a gastroenterologist.
I am.
So what do we want, our folks that we want to live and take care of themselves, what do they need to do?
Well, thanks for having me.
You
first
are
of all,
welcome.
Virginia, and I
Thanks for
appreciate
coming.
it. And yeah, it's so colorectal cancer is the third leading cause of cancer death in the United States. You've got lung cancer, and then either breast or prostate, depending on your particular gender, and then colorectal cancer. And the thing that is really special, or in a way good, about colorectal cancer is there's something that's a precursor lesion. So there's a thing called a colon polyp, and if you have a colon polyp, 90% of the colon cancers probably come from colon polyps. So we know that if we can look for and take out colon polyps in people, we can cut cancer risk down very much. So you asked, what can you do? Get screened.
Get screened.
In a word, get screened. Make sure that you don't have colon polyps, and that'll cut your risk way down.
If they are found early, isn't that one of the most curable cancers that you can have?
So it's two things. Yes, if you're found early, there's a lot of sometimes people have colon cancer and they unfortunately have to have surgery, but they have the surgery and that's all they need, and they're cured. The other thing is if you have colon cancer found during a routine exam, as opposed to waiting for symptoms, you're something like 5 times more likely to survive. So it's impressive. And then the other thing is it can be preventative. So if you don't have colon cancer, but you have a polyp, and the doctor takes the polyp out, it can cut your risk of colon cancer by 3 times.
Wow. Wow.
Yeah.
Most people, they'll wait and wait and wait. They dread that, but it's not as bad as it used to be. It really isn't.
Nobody wants.
Right.
Nobody in their right mind wants to do some of this stuff, but it's far better than having cancer.
Amen.
And if you think that your privacy, some people are concerned about their privacy or modesty or stuff like that, well, trust me, when you get colon cancer, all of that goes out the window. And so once every 5 to 10 years is a lot better than every 2 weeks or something where there's a problem. So I think everybody should get screened. Okay,
let me ask you this then. What is the baseline? When do you start? How often would you have it?
Mm-hmm. So the current guidelines are to start screening if you're an average risk person, and we'll talk in a minute about what puts you at a higher risk.
Okay.
But if you're an average risk person, you should start somewhere around 45 to 50. There's some debate with these societies right now, whether it's 50 or 45. And it's a complicated debate. It gets to, anytime you change health policy in the country, there's a large expense that goes along with it. And so they're trying to figure out what the best way to do it is, but somewhere between 45 and 50 is when you start. And then, in my mind, as long as you do something, that's good. So you can either do a colonoscopy, or you can do DNA-based testing, which is the Cologuard or something where you send some of the stool for DNA-based testing. Either one of those. So if you do colonoscopy and you're negative, you come back in 10 years.
Wow.
If you do Cologuard, you have to do it every 2 years.
Okay, that's fine. There's no prep for
and
that.
the only thing is if a Cologuard comes back positive, it's non-negotiable. You need a colonoscopy.
Okay.
Right. So
that's fair.
If you're, so that's non-negotiable. So, and then if they find polyps, it depends on what they found and the characteristics of the polyps. They'll bring you back on a shorter interval. So 3 to 5 years generally.
Well, I think the most important thing, like you said, is the preventative measure. So either do the Cologuard or do one or the other.
Just do something.
Do something. Don't function from fear when it gets to your health. And thank you so much, Dr. Lambiase, for being with us. Thank you.
Thank you for having me.
And folks, listen to what he says and go do something about it. And stay with us, and we'll be right back.
Thank you.